Your doctor recommends that you have a device called a trabecular bypass stent put in your eye to treat your glaucoma. Glaucoma is caused by increased pressure in the eye. Having this stent implanted helps lower pressure by improving how fluid drains from the eye. This trabecular bypass stent is often placed at the same time as cataract surgery, where the eye's cloudy lens is removed to restore clear vision. In the healthy eye, fluid called aqueous humor is made in the front of the eye and flows out through a tiny drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, eye pressure increases and damages the optic nerve. A trabecular bypass stent provides a new and more direct pathway for fluid to leave the inside of the eye. Trabecular bypass surgery is usually done as an outpatient procedure, so you can go home afterwards. Before the surgery, you will be given anesthesia to numb the eye so you don't feel pain. You may also receive a medicine to help you relax. An injection may be given around or behind the eye to keep your eye from moving. You should feel only mild pressure in your eye during surgery. To implant a trabecular bypass stent, your ophthalmologist will create a small incision in your cornea. Then he or she will place a stent, which looks like a tiny tube, into part of the eye's drainage system. The stent allows fluid to bypass an area that is not draining efficiently. This reduces eye pressure. This stent is usually implanted at the same time as cataract surgery, when the eye's cloudy lens is replaced with an artificial lens to improve vision. As with any surgery, there are possible risks with trabecular bypass stent surgery. Trabecular bypass stent surgery risks can include increased eye pressure, either temporary or permanent, failure to control eye pressure with the need for another surgery, either soon after surgery or much later, eye pressure that is too low, abnormal collection of fluid in the eye, possibly requiring a second surgery, blockage of the stent, dislocation of the stent, damage to the cornea and/or sclera, bleeding in the eye, infection, ongoing swelling in the eye, droopy eyelid, ongoing irritation or discomfort in the eye, and partial or complete loss of vision. There are alternatives to having a trabecular bypass stent. You may be able to have another type of glaucoma surgery, or you may use eye drop medicine. Your ophthalmologist can explain why he or she chose a trabecular bypass stent to treat your glaucoma. You do not have to have a trabecular bypass stent for your glaucoma. However, without this implant, your eye pressure may continue to rise, causing permanent vision loss. If it is left untreated, glaucoma usually leads to blindness. Remember that glaucoma surgery does not improve your vision, but instead helps prevent loss of sight in the future. Treating your glaucoma is important for protecting your vision and your quality of life. If you have any questions or concerns about the trabecular bypass stent, ask your ophthalmologist. He or she will be happy to help you understand the benefits as well as the possible risks of this glaucoma treatment. Also, if you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.